Hello, I'm Dr. Maurie Markman from City of Hope, and I'm going to be briefly discussing a very interesting paper that recently appeared in the Journal of Clinical Oncology entitled Clinical Validation of Human Papilloma Virus Circulating Tumor DNA for Early Detection of Residual Disease After Chemoradiation in Cervical Cancer. Clearly, the concept of minimal residual disease is becoming very important in oncology. Liquid tumor biopsies are in the solid tumor space are increasingly discussed. Obviously, this type of an approach has been used in the hematologic malignancy, certainly in chronic myelogenous leukemia, for a long period of time. But moving this into the solid tumor space is happening very rapidly. So in this particular paper, which I noted, there had been a pilot study where there was evidence that circulating tumor DNA that was HPV related was shown to be present in a significant number of people, women who had undergone chemoradiation. That was sort of was a pilot study. This paper that we're talking about here was a prospective multi-center validation study. There were a total of 70 patients who had known HPV-related cervical cancer, which is essentially all cervical cancer. 70 patients that were treated, and there were a total of 24 events, recurrent events in this analysis. And the primary endpoint was progression-free survival. What the authors report was that patients with detectable versus undetectable HPV circulating DNA at 4 to 6 weeks post-chemotherapy, the undetectable had a 2-year progression-free survival of 82% versus in the women who had detectable HPV DNA, circulating TNA in the blood, had a 2-year disease-free survival of only 15%. Obviously, highly statistically significant. And in fact, the next question might be asked is, well, how long before there was clinical evidence of progression when you had this detectable in the blood? And the answer was the lead time to occurrence was approximately 6 months. So the argument would be is that if you have this circulating cancer-related DNA, HPV-related DNA, and you can document that 4 to 6 weeks, 2 months, maybe 3 months, this is when you might consider starting, and I think we need more data here to confirm this, but the data here is very impressive, to start maybe a next line of therapy. Now, obviously the question might be what that would be available. Here we're talking about chemoradiation. So this is therapy of initial disease. But in fact, if there's evidence of recurrence, the approach might be immunotherapy, which we actually now have good evidence in a large number of patients might benefit from. But this would be the opportunity to potentially start the immunotherapy earlier, perhaps improve the efficacy. Again, more that needs to be learned here, but I think this is a provocative study, which gives us a lead on how we might, earlier in this patient population, define recurrence, potentially institute therapy for metastatic disease earlier, and potentially have more effective therapy. Again, for those of you who are interested in the question of molecular monitoring, certainly the management of cervix cancer, advanced cervix cancer, this is a very important paper, and I encourage you to review it. I thank you for your attention.